Men and women have different hearts. I know, right? Men have a larger heart. Women have a smaller heart. Outside of that, I don't really know a whole lot about it. I'm assuming, okay, before doing any further reading into this article, okay, they basically both function relatively the same, but there's different concerns that everybody should have, okay? Whatever sex you find yourself, and yes, I'm using that term very specifically in a clinical sense, there are different concerns that you should have and different things that you should be made aware of in order for you to have the healthiest heart possible. Keeping your heart in tip-top shape is no small task, but it doesn't have to be difficult. I hope so. An understanding and appreciation for the wonders of the heart and how it functions can be especially helpful when deciding what steps you need to take to keep it healthy. Discovering effective natural ways to achieve this goal is part of the process. So the female versus the male heart. Well, the female heart is warmer and it's bigger, right? Men and women are different in many ways. You don't say. Can we describe a couple? That would be awesome. And this applies to their hearts as well. For example, the female heart and some of its chambers are smaller by ratio than the male heart. Yeah, obviously. I'm, 6'6", 2 and change, but I also have a fairly big frame. And you know what? Maybe it's unlikely that your regular sized woman and I would have the same size of internal organs. But the fact that they're smaller by ratio, that's interesting. A woman's heart pumps faster than men. Yeah, that's something. It's normally just a couple of beats per minute different from a physiological sense. It makes just a little bit of sense, but yeah, no, it makes sense if you take a look at the chambers are smaller and the male's heart sends out more blood with each pump. So women's hearts, or the women's chambers in their hearts are smaller, and then they have to beat more in order to properly circulate the blood through the system. Some of the chambers in the female's heart are thinner and the veins are narrower in some of those males. Those males, it sounds so condescending. When under stress, the female pulse rate rises and result in more blood being pumped. Among males, however, stress leads to constricted arteries and a rise in blood pressure. Right, so men are just trying to kill themselves, and women are supposed to be engaging their fight or flight senses in a different way. That's interesting. Accumulation of plaque causes heart attacks. In men, the plaque is usually hard and affects all three heart arteries. In women, the plaque is usually softer and blockages occur in one or two arteries. Softer plaque tends to break away and travel in the bloodstream, leading to a heart attack. Interesting. Women's hearts are affected by estrogen. Aha! And estrogen levels drop in perimenopausal and beyond, and the heart protective power of the hormone declines, and the risk of heart disease climbs. Aha! Heart attacks in men typically involve a crushing pain in the chest. Hopefully I don't have to experience that, but just the more you know. But women often feel acute pain in the back or upper abdomen. I'm having a heart attack. My back hurts. Weird. Sweating, shortness of breath, and nausea. Sudden cardiac death is more common in men. So don't worry, ladies. I got this one. Women are more likely to have heart palpitations. Oh, the fluttering. I got the butterflies in my chest. Heart attack typically affects men at a younger age than women. It's because them younger women, am I right, guys? Women usually take longer to recover from a heart attack than men. As always, am I right? Like those ladies getting dressed, will they ever get done? Resting heart rate and heart rate of variability. Perhaps you've heard these terms from your doctor. Well, resting heart rate is a good way to gauge your overall health, and heart rate variability is another way to do so, but they're going to give you a little bit more of a detailed description. But heart rate variability, it's also a good indication on when you're putting different stresses on your body, how well and how attuned specifically in this case, your heart is at pumping out the necessary blood to the organs that are being used. Okay, there you go. The more you know, G.I. Joe. Resting heart rate is the number of times your heart beats per minute when you are at rest. Thanks, tips. Didn't have to type in to ask Jeeves that one. This is when your heart is pumping the least amount of blood to provide your body the oxygen needs. According to Women's Health Initiative, a heart rate ranging from 60 to 100 beats per minute is normal. That seems crazy high, but all right. And women with rates at the lower end of the scale may be more protected against heart attacks. Also, That's one of those things. So it's not static within your body. Like, you aren't born at a resting heart rate of this is 63 beats per minute. No, it's variable as well with your cardiovascular health. When you're ill, it will rise. And okay, when you're in top physical peak, or when you're in top physical shape, okay, your diet's on point, your rest is on point, and you're getting the proper amount of exercise, you can lower it, okay? Some ultra marathons that are out there, no word of a lie, have high 30 resting heart rate, okay? That's just how efficient your heart is at pumping blood and getting the muscles in your body oxygenated. Your heart is incredibly efficient at doing that, and any person can do it. You might not get down to the 30s because that is an absurd amount of training, but you can get it down. You can get it down to the 40s, the high 40s. It's possible. I've done it. My regular resting heart rate is in on or around that area. Anywhere from about 50 to, like, I think right now, because I'm a little under the weather, it's about 50. I could check it, but it's about 53 right now. But anyways, enough about me. Let's get back to this. I'm just telling you that there's variability and there's different ways that you can train it. When the researchers evaluated 129,135 postmenopausal women, they reported that those with a resting heart rate of more than 76 beats per minute were 26% more likely to experience a heart attack or die from one when compared to women with a resting heart rate of 62 beats per minute or less. You should always be aiming for about 1 beat per second per minute. How about that? 60. Should always be aiming for about a 60. Okay, that's a good regular person's heartbeat. Heart rate variability is a measure of the variation in time between each heartbeat. This marker is controlled by the autonomic nervous system, which also regulates blood pressure, heart rate, breathing, and other important measures. Unless you're thinking about it because you're thinking about breathing right now. Heart rate variability is traditionally measured using an electrocardiogram, but today's wrist and chest monitors allow people to take measurements at home or whenever they want. Yep, exactly. Basically, if you're anxious or in a stressful situation, the variation is usually low. If you are in a more relaxed state, the variation between beats may be higher. Therefore, individuals with a high heart rate variability may have better cardiovascular health and are better able to handle stress. So, how to improve heart health and prevent heart disease naturally? Cut the sugar. Exactly. You might think about eating too much sugar is only associated with being overweight or diabetes, but in a 15-year study that looked at added sugar and heart disease, individuals who consume 25% or more of their daily calories as sugar are twice as likely to die from heart disease than people who consume less than 10% added sugar. Adopt a healthy eating plan. There you go. Mediterranean dash. I don't know. I don't know any of these, but the Mediterranean diet is basically the fundamental building block of all of the successful diets that are out there. So the fish, greens, healthy fats, you know the rest. Get sufficient sleep, exactly, restful sleep. And that's the reason why I still keep my barely functional Fitbit at this point, because I like to see the variability, the oxygenation variability, okay, how many times I'm waking up during the night, what kind of a quality of sleep I'm getting, because that's about it. That's all I want to know. I could give a crap about step counters and all that nonsense, okay. I do like to know how far I like to run, but outside of that, it really doesn't much matter. I just like to see my heart rate, and I like to see my sleep quality, because if I get the proper quality of sleep, it doesn't matter if I can get like a 90 score on 6 hours of sleep as opposed to an 8.5 hour nice long rest, but I don't get anything. If I get like a 73 score because I'm awake a bunch of different times because my body's weird, I can pretty much base how good of a sleep I'm going to get depending on the other factors, okay? Did I get a good exercise session in? Okay. My diet on point? Am I stressed out about anything? Okay. Do I have things weighing on my mind? Those are all the different things that just add up to having a quality sleep. And other things as well that'll also keep your heart healthy. Okay. Consider supplementation, the proper ones, okay. One of the best supplements for supporting heart health is aged garlic extract. All right, numerous studies have demonstrated the benefits of this supplement for cardiovascular health. Age can stop and even reverse the accumulation of plaque, significantly lower systolic and diastolic blood pressure, so the top and bottom numbers on your blood pressure score, and reduce both total cholesterol and low-density lipoprotein, LDL cholesterol. Other supplements to consider for heart health include coenzyme Q10. I think we've been over that. Okay, magnesium, same. Omega-3 fatty acids, fiber, and green tea. Keep moving. Yes, exercise. Eat in moderation. Again, see above, the healthy eating plan. And manage stress daily. You darn right. Bottom line, this is pretty much universal advice I would recommend, and I employ many of those techniques as well, but this is specifically for the ladies out there. Women can keep their heart healthy in optimal shape by understanding some of the workings of the heart and adopting heart-healthy habits. Be sure to get your blood pressure, heart rate, cholesterol, and blood sugar levels checked at regular intervals as suggested by the AHA or under the advice of your physician. Yeah, they should be running those tests anyways, and if they aren't, clue them into that, because I want your ticker to be safe. I don't know who you are. I don't know you. I don't normally care that much about other people, but I'd like for you to be healthy, because I think the world full of healthy, informed people is a better world overall, and we need more good people than we need, oh God, the current slug of people that are out there. So if you can, be your best self, that'd be great. With that said, thank you all very much for the gift of your time. I've been Don Codswello. I want you to follow your gut and get after it. Take care, everyone.